I am Samer Najjar, the medical director of the Advanced Heart Failure program at the Washington Hospital Center. These are exciting times to be taking care of patients with advanced heart failure. Traditionally, in patients who had advanced heart failure, really heart transplantation was the only option that we had. And some people didn't qualify for heart transplantation, and even those who qualified, oftentimes they had a long wait time on the heart transplant waiting list. And traditionally, up to 20 or 30% of patients who are on the waiting list died while they're waiting for a suitable heart because of the problem of the lack of enough hearts that are available. But now with the LVADs, the left ventricular assist devices, this is revolutionizing the way we're treating advanced heart failure patients. There have been tremendous technological advances in the past decade. In addition, there have been advances in the way we manage patients after they had an LVAD implanted. And we're learning also a lot about when is the right time to implant the LVAD. In the past, we used to wait until everything else had failed and the VAD was used as a last-ditched effort to treat patients with advanced heart failure. What we've learned is that the people who do best are those in whom the VAD is implanted before it's too late, before they develop multi-system organ failure, and that's when they have the best outcomes. And in fact, now the results of the clinical trials have been very impressive. In patients who have advanced heart failure, stage D heart failure, their survival at 1 year is about 25%, and at 2 years it's only 8%. And in the recent studies, again, the second and third generation VADs, what we're finding, for example, in patients who are bridged to transplants, they're having greater than 90% survival at 1 year. Not only that, but now you can offer this to people who otherwise would not be candidate for transplantation, so these will be VADs implanted as destination therapy. The American College of Cardiology and the American Heart Association now has a Class 1 indication, level of evidence A, for people who have advanced heart failure, refractory heart failure, that they should be referred to a center with expertise in treating these patients. And what we've done at the Washington Hospital Center is we assembled a multidisciplinary team that consists of cardiologists, cardiac surgeon, intensivist, VAD coordinators, transplant coordinators, physical therapists, occupational therapists, nutritionists. And our job when a patient is referred to us is to do a comprehensive evaluation. And what we would like to do is partner with you, the referring, and the patient and their families to formulate a plan of care that is appropriate for that patient. So if you have a patient whom you think has advanced heart failure, or even if it's a patient who you're trying to think, gee, is it time yet or not to be doing this evaluation, please don't hesitate to contact us. You can call us at this number that appears on your screen. It's 202-297-9307. That's a BlackBerry that's carried by one of our advanced heart failure cardiologists 24/7. We're available to help you out. Or if you want, you can also call me directly on my personal cell phone, 202-577-5321, and we look forward to helping your patients with advanced heart failure to have a better quality of life and hopefully also a longer survival.